Hey, future nurses! Professor Angoma here, and welcome back to our NCLEX Next Gen prep series. You guys are crushing it, and I'm so pumped to help you ace this exam. Today we're tackling management of care questions, which test your critical thinking and decision-making skills in real-life nursing scenarios. We'll break down some tough questions you might encounter on the NCLEX, so grab your notebooks and let's get started. Alright, let's jump right into our first scenario. Imagine you're caring for an elderly patient with a DNR order clearly outlined in their advance directive. This document is a crucial part of their medical care plan, indicating their wishes regarding resuscitation and other life-sustaining measures. The family approaches you, visibly distressed, and pleads with you to resuscitate the patient if their heart stops, saying they don't believe in giving up. They might express their love and desperation, hoping for a miracle, and it's clear that emotions are running high. What's the best way to respond? This is a delicate situation that requires both compassion and clarity. You need to balance the family's emotional needs with the ethical and legal obligations you have towards the patient's wishes. This is a tough one, and situations like this are never easy. It's important to take a moment to gather your thoughts and approach the conversation with sensitivity. Remember, the family is going through a very difficult time, and their emotions are valid. You've got to remember your primary responsibility is to advocate for your patient's wishes, especially when it comes to end-of-life care. The advance directive is a reflection of the patient's autonomy and their right to make decisions about their own body and treatment. You'd want to approach the family with empathy and understanding, acknowledging their grief and concerns. It's crucial to listen to them, validate their feelings, and provide a space where they feel heard and supported. Then, gently explain that the advance directive is a legal document that reflects the patient's own choices about their medical treatment. It's not just a piece of paper, it's a testament to the patient's values and desires. You can say something like, "I understand this is incredibly difficult for you, and I can't imagine what you're going through." It's important to communicate that you are there to support them while also upholding the patient's wishes. The advance directive outlines your loved one's wishes, and we are legally and ethically obligated to follow it. This ensures that the care provided aligns with what the patient wanted, even if it's hard for the family to accept. It's about respecting their autonomy and ensuring they receive the care they've chosen. By honoring the advance directive, we are upholding the patient's dignity and their right to make decisions about their own life and death. This is a fundamental aspect of compassionate and ethical healthcare. Let's say you're in a situation where the provider, maybe out of habit or a misunderstanding, writes an order for full resuscitative efforts, despite the patient having a valid DNR in place. What's your next move? This is where your advocacy skills really come into play. Remember, you are the patient's voice, especially when they might not be able to advocate for themselves. First and foremost, stay calm and don't panic. You want to address this discrepancy immediately. The best course of action is to politely but firmly approach the provider and clarify the order. You can say, "Dr. Smith, I noticed you've ordered full resuscitation for Mr. Jones. However, his advance directive clearly states his preference for a DNR. Could you please clarify the order in light of his wishes?" This way, you're respectfully advocating for your patient while ensuring everyone is on the same page. Chapter 3: Delegating Tasks to LPNs. What's within their scope? Now, let's shift gears and talk about delegation. Delegation is a critical skill in nursing, allowing for efficient and effective patient care. It involves assigning specific tasks to other healthcare team members, such as licensed practical nurses, LPNs, while ensuring that the tasks are appropriate for their level of training and expertise. As an RN, you'll often delegate tasks to LPNs. This not only helps manage your workload, but also ensures that patients receive timely and competent care. However, it's important to understand the scope of practice for LPNs to delegate tasks safely and effectively. Remember, it's crucial to delegate safely and effectively, ensuring the task is within the LPN's scope of practice. This means understanding what LPNs are trained and legally allowed to do. Each state may have different regulations, so always be aware of your local guidelines. So, imagine you're working on a busy medical surgical floor, and you need to assign tasks to your LPN. This scenario is common in many healthcare settings, where the demand for patient care is high and efficient task management is essential. You have 4 patients who need care. Each patient has different needs, and it's your responsibility to ensure that all necessary tasks are completed while maintaining high standards of care. Which task would be appropriate to delegate to the LPN? This decision requires careful consideration of the LPN's skills, the complexity of the task, and the condition of the patient. Remember, LPNs are skilled professionals, but their scope of practice differs from that of an RN. They are trained to perform specific tasks and provide care under the supervision of an RN or physician. They can handle tasks like medication administration, except for IV push medications in most states, and routine care for stable patients. This includes tasks such as taking vital signs, dressing wounds, and assisting with personal hygiene. So, in this scenario, you could delegate tasks like administering oral medications or giving an intramuscular injection to a stable patient. These tasks are within the LPN's scope of practice and can be performed competently by them. However, tasks requiring a higher level of assessment, like developing a care plan or providing patient education, should be handled by the RN. These tasks require critical thinking and advanced knowledge that are part of the RN's training and scope of practice. Effective delegation not only improves patient care but also enhances teamwork and job satisfaction among healthcare staff. By understanding and respecting each team member's scope of practice, you can create a more efficient and harmonious work environment. Chapter 4. Delegating to nursing assistants, playing to their strengths. All right, let's talk about delegating tasks to nursing assistants. They're a vital part of the healthcare team, and knowing what tasks they can handle safely and effectively is key to providing excellent patient care. Let's say you're on a busy post-op floor, and you need to delegate some tasks to your nursing assistant. You have a few patients who need attention. Which task would be appropriate to delegate to the nursing assistant? Nursing assistants are great at assisting with activities of daily living, like bathing, dressing, and toileting. They can also take vital signs, help with ambulation, and report any changes in a patient's condition to the nurse. However, they cannot perform sterile procedures, administer medications, or provide patient education. So in this scenario, a good task to delegate to the nursing assistant would be something like helping a stable post-op patient to the bathroom or taking their vital signs. Chapter 5. Prioritization. Who needs your attention first? Let's dive into a classic NCLEX scenario that tests your prioritization skills. This is a crucial aspect of nursing that can significantly impact patient outcomes. Prioritization is not just about managing tasks, but about making critical decisions that can save lives. Picture this. You're an RN on a busy medical surgical floor, and you've just received a report on 4 patients. Each patient has unique needs and varying levels of urgency. Your ability to prioritize effectively will determine the quality of care each patient receives. You need to decide who to assess first. This decision is critical and must be made quickly and accurately. The wrong choice could delay necessary care for a patient in need. Remember, in nursing, we use the ABCs, airway, breathing, and circulation to prioritize care. These are the fundamental principles that guide us in determining the most urgent needs. So, let's look at your patients. Each one presents a different challenge and requires a different approach. Your ability to assess and prioritize will be put to the test. You have a patient with pneumonia whose respiratory rate has increased from 16 to 28 breaths per minute. This significant change indicates a potential deterioration in their condition. You also have a patient with diabetes who needs their blood sugar checked before breakfast. Managing blood sugar levels is crucial, but it may not be as immediately life-threatening as other issues. Then, there's a patient who had surgery yesterday and is requesting pain medication. Pain management is important for recovery, but it must be balanced against more urgent needs. Finally, you have a patient who's scheduled for discharge later today and needs teaching on wound care. Discharge planning is essential for ensuring continuity of care, but it can usually wait if more pressing issues arise. Who are you seeing first? This is where your critical thinking and prioritization skills come into play. You must evaluate the severity and immediacy of each patient's condition. In this scenario, the patient with pneumonia and the increased respiratory rate should be your top priority. Their condition could rapidly deteriorate without prompt intervention. Their airway and breathing could be compromised, requiring immediate assessment and intervention. Ensuring they are stable is paramount before moving on to other patients. Remember, when it comes to prioritization, Always address the most critical patient needs first. This approach ensures that you provide the best possible care and improve patient outcomes. That's a wrap for today's deep dive into management of care questions. I hope you found these scenarios helpful and feel more confident tackling these challenging NCLEX questions. Remember, practice makes perfect, so keep reviewing these concepts and applying them to different scenarios. You've got this! Don't forget to smash that like button if you found this video helpful, and subscribe to our channel for more NCLEX prep content. Hit the notification bell so you don't miss any future videos. And as always, drop your questions in the comments below. I'm here to help you succeed. Until next time, stay awesome, future nurses!